Hi, welcome to the presentation on the analysis of the given case study. The topic is BC cancer connected to chatbot to improve patient support. So, I am Nipunika Dilshani, and we'll move forward with the background of the study. So, once I have read the case study, I have identified several challenges existing inside the process of implementing the chat box in the BC cancer. So, out of that, I have summarized three main important challenges identified, such as inability to participate. It means the access restrictions, like the patients need to submit their IDs, and other regional restrictions are there. And the second thing is the low integration, which means that the nurses don't like to move from the conventional platform to the digital platform. And the third one is the visibility, means there are limited placements inside that chatbot programs. So this implementation has not been successful inside the BC cancer. So this analysis is to make it successful in the future, and what would be the benefits of these instruction implementation like that. So we'll move forward with the analysis further. So in the next slide, I have categorized what would be the benefits if this is implemented successfully and what would be the challenges. So first one is workload of the employees. It would be reduced once if this platform is successful in the future. And the second thing is the persons who getting the benefit of this platform, means the patients would not be want to they would not wanted to wait for their in person. They would not want to meet the doctors in person, and they will get the reply in soon. So the third thing is accessibility of the information would be increased. It means 24/7 days this program would be processed, so that patient would get better results. And throughout this chatbot's information, the healthcare professionals can maintain their regular records, and they can convert this information into a database as well. Once it comes to challenges, the challenges are, as I explained earlier slide as well, the challenges may be the restriction from both the nurses and healthcare professionals and the patients. They would not like to change their attitudes towards the digitalization. And other thing is the accessibilities, and another one is the privacy issues. Once it comes to the digitalization process, privacy becomes the foremost thing, so it would be a great challenge. And in the next slide, it is described how if the healthcare professionals in BC Cancer are going to implement a chatbot program further, what are the selection criteria? First thing, it would be user friendly, and users may be able to access it conveniently, and there should be integration, and the data should be secured there, and it should be evaluated whether it's cost beneficial. And in the next slide, it is described about the risks that are involved with implementation of this digital health solution. There are mainly three risks involved. First one is the risk of privacy. Once the digitalization comes, the risk of privacy goes high, so they should involve with the method to mitigate that risk. And the other thing is the financial risk. It linked with the cost beneficial challenge as well, because if they are implementing these kind of chatbot program, their benefit should be goes up. And the third one is the risk of operation, because if patients do not like to move with this, their operation would be less. So there's operational risk as well. For those three risks, the healthcare professional should give the solutions as well to mitigate the risks. And the next slides, it's describe how digital health solution can be considered in healthcare settings. So once I have analyzed the international level healthcare solutions for the digitalization. There are telemedicine, electronic health records, and AI-driven chatbots. So, Cleveland Clinic is one of the great examples of the telemedicine, and NEHRS is a great example for the electronic healthcare records in Singapore. And AI-driven chatbots, it's very fast and easy. And here, why chatbots can be used in cancer care. As I explained earlier, it's 24/7 days accessible. So there would be emotional support for the cancer patients. Once they want to talk with someone, they can use the chatbot program. They could be they emotionally supportive and store the information itself and can be used as a database in the future purposes, and do not want to duplicate the test. Once the tests are done in the chatbots, it almost already saved, so it's reduce the duplication of the test, and it can be used as a communication tool and to make reminders and alerts as well. So here it's analyze what are the benefits of a centralized and a decentralized method of chatbots. So in a centralized method, it would be consistent. Information gathered from patient can be stored centrally. So once it comes to the decentralized, there would be a great customization inside. So the challenges in a centralized system is failure of a centralized hub gets collapsed the entire chatbot programs, and when it's come to decentralized platform, it's inconsistent experiences of the patients. So maintaining problems are also there in decentralized method. So I can recommend some programs while analyzing the international platform for the chatbots program. So one is the chatbot in Germany, Ada Health. It is used for across Europe and used to process of medical diagnostic symptoms. That BC Cancer also can use this program platform to implement their program. And chatbot in United Kingdom, Babylon Health is another good recommendation, and chatbot in United States, maintained by MediAnalysis, also another great example. And here it's also described further the recommendations like Ada Health, Babylon. These are the platforms used in the industry's mostly successful chatbot programs. So once I concluding my presentation, I can share that with you that a connected chatbot program in BC Cancer would streamline the operations and would act as a communication process as well. So ongoing training would avoid the potential risk in future resistant to change, and it would ultimately ensure the quality of this chatbot program. So these are the references, and thank you for listening my presentation. Thank you.